Dr. Adams, in my state, the three groups of people who have been disproportionately affected by COVID 19 have been frontline healthcare workers, Black residents of my state, and nursing home residents. Who is going to make the decision on the allocation of the vaccine once it becomes available? Who will decide who gets the vaccine first?
Thank you for that question, Senator. And you hit on some of the key points: healthcare workers, nursing home workers, and people of color disproportionately hit by this virus. Important for people to know that we aren't just making this decision in a room. We're working with the National Academies of Science, Engineering, and Medicine, with, again, professional organizations and other advisory groups to come up with an answer to this incredibly difficult question about who gets the vaccine first. I can tell you some principles that we agree on. There are no final recommendations yet, but principles are that healthcare workers and frontline workers should be first in line because we know they're most likely to be exposed and most likely to spread. Behind them, it's looking at who is most vulnerable and using a scientifically driven and data-driven process to determine who is most vulnerable and where that vaccine will have the biggest impact. So what the American people need to know is we're thinking about this now. We're working with an array of partners to make sure it makes sense and it is ethically appropriate to distribute vaccines in a way that we ultimately will have the largest impact.